And what does multifactorial mean in that context?
A vague way of saying all the things I was specific about.
Okay. That there are a lot of different factors in the care.
Absolutely. Again, implied by team approach.
Team approach. And the goal, obviously, is to get the person off whatever drug it may be and get them leading a healthy, productive life, correct?
Correct. In my experience, sir, getting them off the drug, which is really my specialty, and comfortably withdrawing them from their substance of abuse is the easy part. Keeping them sober is the hard part.
Now, I wasn't clear. Do you know what Restylane is?
Personally, I have no experience with Restylane. I asked the plastic surgeon what it was, so I would know.
Okay, and it's a skin filler, right?
I think so.
For acne scarring or any type of dermatological scarring, things of that nature?
I honestly don't know its precise use. I have no expertise in dermatology, cosmetics, plastic surgery, etc. But I did, sort of curb consult a friend and say, "What is this stuff?" And that's my understanding of what it is.
And you noted in the medical records, the dermatology medical records, there were Restylane treatments, there were Botox treatments for different parts of the body, correct?
Yes, sir.
And some of these injections were into, for example, below the right orbital, in the right cheekbone, in the chin, in the nose, various locations, correct?
Correct.
And these are documented in the medical records, correct?
Yes.
Frequently with diagrams, for example, of the eyes or the face where the injections were given.
I would say actually infrequently.
There are diagrams showing where the injections were given.
There are occasional diagrams.
And certainly not every page has a diagram. Would you agree with that?
I believe so.
When do you use Demerol in your practice?
I haven't used Demerol probably for 2 decades. There are much better medications and safer medications.
Now, if someone was addicted, let me just ask you, and let me know if you can answer it, is if someone's addicted to a drug, and they stop using the drug, is the point at which you expect to see withdrawal symptoms, does that vary based on the type of drug?
Based on the length of use, the quantity of use, the type of drug, and even then, what makes this so interesting is that there's individual variation. It's difficult to predict.
Okay. But does it, if you said everything else is equal, I'm just curious, does it vary based on the drug alone?
But you're asking me, does the onset of withdrawal vary based upon the drug? Again, it depends upon the amount of the drug. It depends on the specific drug, yes, et cetera.
Okay. So giving a window of time then, if someone, for example, Mr. Chernoff asked you about the last Demerol injection being June 22nd, at what period of time from that last injection, if Michael Jackson was addicted, would you expect to see the withdrawal symptoms?
Let me correct your statement, if I may. You mean
well, it's not a statement; it's a question.
Thank you. Dependent. So, if Michael Jackson got Demerol, did you say on the June 22nd?
That's what Mr. Chernoff asked you, and you were able to answer it.
Okay. Well, he showed me the record. That's how it. So I'm just asking you to refresh my memory, please.
June 22nd.
Okay. Thank you. Demerol has a short half-life. 3, 4, 6, maybe 8 hours. The metabolite accumulates, so that might have some effect as well. So I would expect that 8 to 10 hours after a Demerol dose, he probably would not feel well.
So you would expect to see withdrawal symptoms of some sort between 8 to 10 hours?
Possibly. And you're asking specifically about that date. And
Well, disregard the date. I'm just asking because that was the last date reflected in the records. But let's pick whatever date you want, whatever month you want. I'm asking you when the Demerol injections stop, whatever date, when would you expect to see withdrawal symptoms?
within a day.
Okay. Now, you prepared a chart documenting the injections in June of 2009, correct?
Can you show me that, please?
Well, I just asked you a question. Did you prepare a chart documenting the injections of June 2009?
I did.
Okay. Can I have a chart here? I'd ask it be marked People's Next in order. I believe 226.
226.
Thank you, Your Honor.
Thank you.
Let me show you this, Dr. Waldman. You can tell me if it's a chart you prepared for defense counsel. Looking at People's 226, do you recognize that?
No.
You did not prepare this?
Can you hand me that chart?
Sure, sure.
Thank you, sir.
Showing it to the witness, Your Honor.
Thank you.
This is not my chart.
What chart did you prepare?
I had the secretary in my office chart for my review the Demerol and midazolam doses that were discussed during prior testimony.
So if this was given to me represented as a chart from you, this was...
Just a moment, please. I'll sustain the objection. You can refine a question.
Have you ever seen this chart before?
No, sir.
All right. Let me ask you, let me put it on the screen.
Objection to relevance.
I'll overrule the objection. Counsel can inquire.
Well,
Now, I want to reference this as we go through the records that was
Your Honor,
referred to.
this chart hasn't been identified as anything yet.
May I see counsel, please? Please continue.
Thank you. Dr. Waldman, you testified regarding the Demerol injections in June 2009 when Mr. Chernoff was going through that with you. Do you remember that?
I do.
And we've already heard it, but let's see if we can hear it again. And that is, did you or did you not create this chart?
I did not.
All right, thank you.
And may I approach the witness, Your Honor?
You may.
Dr. Waldman, can you just take a moment looking at People's 226, and I have the records here with me so you can confirm whether it's accurate or not.
Thank you.
What is you see the first date entry there of June 1st, 2009?
I do.
And you see, I'm holding, you see June 1st, 2009, the records you've already testified to?
I do, thank you.
And you see a Demerol injection of 200 milligrams?
I do.
Okay, is that accurately reflected on People's 226?
It is.
Going to the next date of June 3rd, 2009. And again, do you see the date of the records, June 3rd, 2009?
I do.
And two separate dosages of Demerol for a total of 200 milligrams. Is that accurately reflected on People's 226?
It is.
Then going to the next date of June 9th, 2009. Do you see, and again, you've already testified to this, the two separate doses of for a total of 200 milligrams. Is that accurately reflected on People's 226?
Yes, sir.
Going forward to the next date, showing you the records, June 16th, 2009. Do you see a dose of 100 milligrams of Demerol?
I do.
And is that accurately reflected on People's 226?
Yes, sir.
And then going to the last date of June 22nd, 2009, do you see another dose of 100 milligrams of Demerol?
I do.
Okay, and is that accurately reflected on People's 226?
Yes, sir.
So that People's 226 is an accurate representation of what is reflected in the medical records that you've already testified to, correct, for the month of June?
Yes, sir.
Now, if you would expect to see, well, let me just ask you, this is inconsistent, is it not, with expecting to see withdrawals within 8 to 10 hours, that we have this kind of time frame between injections?
What, on what day?
Well, looking at People's 226, so from June 1st to June 3rd, so from June 1st, according to the records, Michael Jackson went 3 days before he received another injection of 200 milligrams, correct?
I'd like to refer you, sir, to the fact that he used extensive, large doses of Demerol all through April, all through early May, and again at the end of May.
Did you understand my question?
I do, but we have to consider the prior use as well, sir.
You did understand my question?
Rephrase it.
I'm sorry?
Please re-ask it.
Can I have the court reporter read it back, Your Honor?
Yes, before she does that, do you want some more water?
No, I'm good. Thank you.
Thank you. Mrs. Theodora?
Looking at People's 226, so from June 1st to June 3rd, according to the records, Michael Jackson went 3 days before he received another injection of 200 milligrams, correct?
Just to read the chart into testimony again, I see on the 1st and the 3rd a total of 400 milligrams of Demerol. We have no record to review between the 3rd and the 9th, and then on the 9th he received 200 milligrams. So we have no data for the dates in between.
Interesting. Can I have the court reporter read back the question again, Your Honor?
You may re-ask the question. Is there an objection?
Yes. It's been asked and answered.
It has not been answered.
Just a moment, please. The objection is overruled. I was asking the people if you had an objection.
Yes, non-responsive.
Sustained.
Motion to strike.
The answer is stricken. Disregard the last answer. We'll have the question re-asked.
Thank you.
Mr. Waldman.
Dr. Waldman, from June 1st, there was a 200 milligram injection of Demerol, correct?
Yes, sir.
And then, according to the records, there were 3 days elapsed going to June 3rd when Michael Jackson was given another injection of 200 milligrams, correct?
Sir, that would be 48 hours, 2 days. The 1st to the 3rd, please.